next week, the World Health Assembly will hold its annual meeting, and there's a special focus on the pandemic. Now, the WHA is the decision-making body that oversees the World Health Organization, the WHO. And there's been a lot of criticism over how that UN agency has responded to this global health crisis. One of the criticisms is that it is overly influenced by one of its members, China. The United States remains the main financial contributor, although the Trump administration has said it wants to freeze funding because of some of these problems. Lanhee Chen has been a critic. He is a member of the Hoover Institution, a Republican policy advisor, and a friend of Face the Nation. Lanhee, it's good to talk to you.
Thank you, Margaret.
So given that this is a global pandemic and anywhere this virus exists means it's a threat to Americans since there's no vaccine, don't we need a World Health Organization now more than ever?
I guess what I would say, Margaret, is we need a functioning World Health Organization. We need a World Health Organization that is consistent with its charter, which is to promote public health around the world and to deal with some of these transnational challenges like this coronavirus crisis. The difficulty, though, I think, is in their response to this coronavirus. The World Health Organization has demonstrated ways in which it has been ineffective, or worse yet, captured by the Chinese Communist Party and interests of China as opposed to thinking about the interests of public health more broadly. And so I think we have to ask whether this organization at this time is functioning in the way that we want it. And I think we're right to push for reform. The question is going to be, is that reform, for example, making the World Health Organization more accountable? Is that something that's going to happen now, or is it going to be the context of after this pandemic is passed?
And that timing is a key difference when it comes to some of America's allies. The UK, Germany have said there does need to be a review, but let's worry about that after we get past this period of mass death, that there's a more immediate crisis. Australia, however, has said they do want an inquiry now, as does the United States. Why does that matter? Why does the now part matter?
Well, I think it matters insofar as the response continues to be affected inordinately by China and what the Chinese government might want. I think a lot of people believe, a lot of scientists believe, that we are headed for future waves of this coronavirus. So once we're sort of done with this wave, maybe we'll have another one in the fall and winter. And the problem is, if the World Health Organization is compromised in some way, if it is not the most effective body for responding to these challenges, then that has to be ferreted out now. That is something that needs to be determined now, as opposed to waiting for some date in the future when we may or may not have more time to examine the situation. So I think precisely because the World Health Organization is in the middle of the pandemic response, this is exactly the right time for us to be assessing the efficacy of the organization and ways to improve upon it as it seeks to respond to the crisis.
Do you support the freezing of U.S. taxpayers' money?
I think that it is one of the ways to get the World Health Organization's attention. I've said before that if you look at the amount of money that's being devoted by the WHO to pandemic response, it is an extremely small percentage of what it spends overall. And in fact, much of the US response for the pandemic has already been funded. So in some ways, the freezing of funding is more symbolic, I think, than actual. It is a way to sort of force a response within the World Health Organization. Ultimately, I'd like to see the WHO become more effective. I'd like to figure out a way to reform it and to make it stronger. The problem is that that's going to be very challenging to do without some real sort of threat or some real forcing mechanism. And I think that President Trump and the Trump administration have tried to move in that direction.
The chief criticism is that the World Health Organization wasn't raising, louder concerns earlier on, and that the human-to-human transmission part of the equation, the thing that makes this so deadly, was not shared. The other side of that is this is a UN organization. They are influenced by their members. They are constrained by that, and they can't force anyone to do anything in any country. That's just the way these organizations function. So is this just in some ways a domestic political dispute being overlaid on a bureaucratic organization that already had these issues?
In some ways, the WHO is going to be beholden to its member countries. The question in this situation is twofold. One, why is it that they were so beholden to China as opposed to other members? And you've already noted the US is the largest contributor to the WHO. Why not consider the different perspectives of countries in managing or in putting out information about what was happening in China initially with the virus? I think that's the first issue. But the second issue is history actually tells us that the WHO has had periods of time where it has pressed member states more directly. If you think back to the SARS epidemic, the original respiratory disease that affected Asia in the early 2000s, the WHO, under different leadership at the time, was on the front lines of pressing China as to why it did not reveal information more accurately and quickly. So we know the WHO can do this. The question is, why haven't they done it this time, and what is different? And I would suggest it's leadership, but also organizational decay, things that need to be fixed quickly.
Is your diagnosis of the problem here that it is a problem at the very top of the World Health Organization, or that it's the entire bureaucracy that's broken?
Well, I think that the leadership of Dr. Tedros is a significant problem. I do think that he sets the tone, and every WHO director general indeed sets the tone of the organization to a certain degree. So I do think that is the principal problem. I think there are also some bureaucratic issues. For example, the way that the WHO is organized, such that regional directorates sometimes can have a significant amount of control, which takes away from the ability, for example, of the central organization to coordinate on some things. There are definitely bureaucratic issues.
It was towards the end of January that the World Health Organization issued its most alarming declaration, calling it a global public health emergency. President Trump was still praising China, saying they had it very much under control.
We think we have it very well under control.
Repeating things like this, sort of showering Chinese leadership with praise. His allies would say, well, this was to try to get what we want in terms of access, something that never actually ended up happening. But don't these public statements possibly reflect the same thing the World Health Organization was seeing, was based on what they were getting officially from the Chinese government at the time? They didn't know any better. I mean, did President Trump know any better when he was saying these things?
Well, I think that we're going to have to discover that, which is why some are keen to see, for example, the intelligence that President Trump was seeing and the Trump administration was seeing in January. How much of our information collection in the intelligence community was either consistent or dissonant with what the Chinese were saying? I think that is a very important piece of information that in the after action here in the US, we're going to need to get a handle on, is exactly how much the administration knew and when in terms of our response. But it is absolutely clear that the WHO has been relied on, not just by the US, but by a number of countries around the world to provide assessments of what's going on when we're dealing with these sorts of pandemics. And so it is important for us to figure out why the WHO was so keen to shower President Xi and the Chinese government with praise for its response as well.
One of the other things that diplomats I had spoken to were pushing for prior to the president freezing funding to the World Health Organization was for Taiwan to be allowed, at least in an observer status, to attend these key meetings like the one that's coming up next week. Why is that such a sticking point?
The government in Beijing repeatedly has tried to deny Taiwan the ability to participate in the WHO. Taiwan actually had observer status in the WHO for many years until the current administration in Taiwan, which is perceived to be more hostile to the mainland, until that administration came into office. The reason why it's critical in the context of the current crisis is because Taiwan has been a model of effective response to coronavirus. It has managed to keep the number of cases under control. It has managed to put in place a system that allows the government to understand when things might be spiraling out of control to quickly bring them back under control. So there are reasons why we might want the international community to learn from Taiwan. By prohibiting Taiwan's participation in next week's World Health Assembly meeting, which, by the way, the WHO reasserted that position only yesterday, only this week, that really does raise some challenges in terms of being able to get the best information out there, and seems to say the organization wants to put politics, frankly, ahead of public health.
A lot of this conversation in the US right now gets overlaid with two things. One, a very hawkish sentiment from the Secretary of State towards China, which has been there long before the pandemic.
Good morning, everyone.
But also this sense of xenophobia, that there is a domestic political benefit to blaming someone else, specifically China. and that has other motivations for the president or some kind of dog whistle to it. How do you fit those pieces together? What do you make of that reception?
From my own perspective, I think it's entirely fair to be critical of what the Chinese government has done. It's entirely a fair critique to say that China, in many ways, whether in the current crisis or other issues we've had with them, human rights, et cetera, that the Chinese government, there's good reason to criticize them. How do you separate that from the need, for example, to say, look, that doesn't mean that we should go and categorize all people of Chinese descent in the United States as somehow affiliated with or part of China. There's a real danger there, I think, when that line gets crossed. And the problem, Margaret, is you know from covering politics for a long time, is that line, it gets blurred. It gets, there's no room for nuance in political conversation, certainly not in campaigns. So it's a line that I think both President Trump and Vice President Biden in this upcoming campaign, both of them have talked about China as an issue. They need to be keenly aware of the fact that there is a line that once you cross that line, it will become very, very challenging for the Asian American community in the United States.
Interesting. We're going to continue to track that. I want to ask you about a plan that you have laid out to try to reopen the United States and stay healthy. Your former boss, now Senator Mitt Romney, was in a congressional hearing sharply critical of the Trump administration's ability to roll out testing in this country.
Our testing record, nothing to celebrate whatsoever.
What kind of expectations should there be on testing, specifically to the plan to reopen the country?
It is quite clear the point that Senator Romney and others have raised is that it took us an awful long time to ramp up that testing. And as with the situation with the WHO and what they were saying about coronavirus, in the same way with testing, the timing of this matters a lot. And so the fact that we didn't have more earlier was a challenge, and it did put us behind the eight ball. I think going forward, I've talked, for example, about how we can get college campuses reopened this fall. We're not going to be able to do that, I think, unless we've got a lot of testing available for colleges to deploy to figure out who on campus might be infected, what faculty might be infected. I think those are going to be really important questions. So testing is a big part of the picture. There's no question about it, but it's not the only thing we need to get right going forward.
And we spoke to UVA's president about that on Sunday's show, and he described the same thing. It's basically planning for a small city. You're out there at Stanford. Testing, contact tracing, all the things you'd put in place for a city, you need to put in place for a university, right?
Contact tracing is going to be important. Good, effective communication, so you can let people know when they may have been exposed, figure out a way to communicate things to the student body. There's also the unique challenge in the college setting of the residential problem, which is you've got a bunch of people that live in very close proximity. How do you deal with that? How do you deal with older faculty members and how they might be disproportionately affected if they come into contact with it? So these questions that affect colleges and universities, they affect K through 12 schools. I still think, though, that part of the plan that you mentioned, Margaret, is that we actually think trying to figure out a way to get the K through 12 schools online, meaning in person, not just virtually, that's going to be a really, really important piece of the puzzle. We've got to get that part right if we want the economy to open up in any real substantial way as we move toward the end of the year.
Absolutely. Thank you very much, Lanhee Chen.
Good to be with you.